Good morning, everyone. My name is Isaac Stein, and today I am honored to present the human element in imaging, lessons from Matilda Stein. As students in the Radiologic Technology program here at Rasmussen's, we spend a massive amount of our time mastering the physics of our profession. We learn about the anode-Hill effect, the inverse square law, and how to critique a suboptimal image. But what we sometimes forget is that the most complex variable in the room isn't the X-ray tube. It is the person standing in front of it. In this presentation, I'm going to walk you through an interview I conducted with an 87-year-old woman who has seen the healthcare system from both sides of the spectrum. We're going to look at the geriatric population, which is currently the fastest growing group in our healthcare system. These patients aren't just names on a digital requisition. They're individuals managing chronic conditions like hypertension and arthritis that fundamentally change how they experience a radiology department. My goal today is to show you how a 16-year-old girl's journey from Nicaragua can teach us to be better, more empathetic technologists. To really provide patient-centered care, you have to appreciate the history that every geriatric patient carries with them. Matilda Stein was born on May 27, 1938, in a rural pocket of Nicaragua. When she describes her childhood, it sounds like a different world entirely. She talks about the smell of fresh tortillas in the morning and playing near lush coffee plantations. There wasn't any modern plumbing, and the doctors weren't something that you saw every day. She eventually had to drop out of school and dropped out even before high school to help her family survive. At 16, she made the life-altering decision to move to Tampa, Florida. She told me that when she arrived, she was shocked. The cars, the big buildings, it made her feel like she was just on another planet. She spent decades working labor-intensive jobs, cleaning houses, and even working in factories, all to ensure her children had the opportunities that she didn't have growing up. Throughout her life, she found peace in sewing and even crochet. When we see an elderly patient who might be slow to move or struggling to follow a command, we have to remember this history of hard work and resilience. They aren't difficult patients, they are individuals who are spending a lifetime overcoming obstacles much larger than an X-ray table. During our interview, Matilda was incredibly candid about what it feels like to age. She described it as a brutal struggle between her mind and her body. For her, the most difficult part isn't the medical appointments, it's her loss of independence. She gave me a quote that I think should be posted in every imaging suite. "My mind wants to go for a walk in Tampa, but my legs and my arthritis say no. It is frustrating to need help with even the small things." Let's think about that for a second. When we ask a patient to step up onto a platform or hold this position, we're often highlighting the very things that they can no longer do for themselves. However, Matilda also sees aging as a triumph. She looks at her grandchildren and great-grandchildren and sees the fruit of her decision to leave Nicaragua all those years ago. As technologists, our job is to facilitate that dignity. If we can make a patient feel capable during an exam, we are treating more than just the anatomy. We are treating their spirit. Now, let's look at the clinical reality Matilda deals with every single day. She manages chronic hypertension and arthritis. From a radiologic standpoint, arthritis is one of our biggest challenges. It creates physical limitations that make the standard positions we learn in the lab, like frog leg lateral or even a simple oblique, extremely painful. If we force a patient into a position without acknowledging their pathology, we aren't just being inefficient, we are being unkind. Beyond the physical, we have to talk about polypharmacy. Matilda takes several medications a day to manage her heart health. She mentioned that these pills often leave her feeling tired and fuzzy. In our field, we have to recognize that this fuzziness is a physiological side effect, not a lack of intelligence. If a patient is slow to respond to your breathing instructions or seems confused about which way to turn, remember Matilda's fuzziness. We have to adjust our communication to meet them where they are, rather than expecting them to keep up with our fast-paced clinical schedule. Matilda's history with the healthcare system serves as a perfect case for us to study. She shared a good experience involving a nurse who didn't just go through the motions. This nurse used a translator, didn't even look at her watch once, and even held Matilda's hand when she was nervous about a scan. Matilda said that interaction made her feel like a person and not just a number. That nurse understood the power of nonverbal support and the importance of pacing. On the flip side, she described a bad experience, where a technician spoke too fast and seemed visibly annoyed that she didn't know exactly where to stand. Matilda recalled feeling small and even invisible because she couldn't speak for herself. This is the danger of fast-paced environments like the ones we work in. When we rush, the patient's dignity is the first thing that we lose. So Matilda's advice to us as students is simple. Be patient and treat the person, not just the X-ray part in which you are imaging. Communicating with geriatric patients requires a different toolkit than we use for younger adults. First, we have to address the language barrier. For ESL patients like Matilda, the hospital is an intimidating place where they often feel like they don't belong. If we don't provide translation services, we are effectively taking away their voice. Second, we have to account for the pacing of instructions. Between hearing deficiencies and the fuzziness of polypharmacy, our words need to be clear and moderate in pace. We must also avoid elder speak, that patronizing, high-pitched tone people sometimes use with the elderly. It is disrespectful and unnecessary. Effective communication is the bridge to patient comfort, especially in an environment like radiology departments that can feel cold or even clinical. So, how do I plan to change my practice based on what I've learned from Matilda? I have developed a 4-pillar strategy for my future career. First, starting with pacing and verbal clarity. I will speak clearly and at a moderate pace, ensuring my instructions are straightforward and easy to understand. This is vital for patients dealing with polypharmacy-related confusion. Second being nonverbal support. I will maintain eye contact and use a supportive tone. Matilda's story about the nurse holding her hand taught me that when words fail, especially across language barriers, small gestures can provide immense peace. Third, translation resources. I will prioritize using professional translation services or even tools like Google Translate for every ESL or English as a second language patient. No patient should ever feel invisible because of the language that they speak. And fourth, patients with mobility. I will allow extra time for positioning on the X-ray table, recognizing that movement can be physically painful for those with arthritis. I will offer help in a way that assists the move, but respects their desire for independence. In conclusion, my conversation with Matilda Stein was a profound reminder that we aren't just taking pictures of bones. We are taking care of the people who have lived entire lifetimes. Geriatric care isn't just about managing a disease or even a pathology. It's about recognizing the human being in front of us. As I move forward in this program, I will carry Matilda's advice with me to be patient and to remember that every elderly patient was once a 16-year-old with big dreams. By slowing down and communicating with respect, we provide better care and a better experience for every person who enters our department. I want to be the technologist who makes a patient feel like a person and not just a number. So thank you for your time today. and I hope that you'll carry some of Matilda's wisdom into your own clinical rotations going forward. Thank you for your time, and have a blessed day.